A new study goes to the heart of a difficult challenge facing the Canadian healthcare system. We all know the population is aging as the baby boomers head into their 60s. Well, the doctor population is also aging, raising the question who will take care of Canadians as healthcare demands start escalating. For more on the study and what was learned, I'm joined by Jeff Ballinger, Manager of Health Human Resources with the Canadian Institute for Health Information. He joins me from Ottawa. Good afternoon.
Good afternoon.
What did you learn in the study?
Well, our organization has been tracking the supply, distribution, and migration of physicians across the country for decades, virtually. And one of the things we have been tracking is the average age of physicians. And the average age of physicians has been increasing gradually over the last several years, and it currently rests at around 50 years of age on average across the country. We also know that about 20% of the physician workforce is over the age of 60. So as this workforce, the oldest workforce in the healthcare system, continues to age, we were interested to understand what it would look like when they started to reach their retirement years. So in this study, we've used some of the databases at my organization and tried to quantify what the physician retirement looks like. And one of the interesting things that we found was that over a third of physicians over the age of 65 are still working full-time. And we also found that of the two-thirds of the physician workforce who aren't working full-time, they're still working 40% of a full-time workload. So they're working quite a bit as well. So what we're actually finding is that physicians don't retire at, say, age 65. They are gradually reducing their workload and slowly easing out of the profession over an extended period of time, over years and months.
So when we hear so many Canadians complaining about not having access to a family doctor now, overall, what kind of near future are you predicting? Will the situation get much worse, or what do you see?
Well, in terms of one of the things in trying to understand the number of physicians we have in the country, one of the things that's important to understand is how physicians are exiting the profession. That helps us to understand how many physicians are required to come into the profession to replace them. In another report that we've done just last fall, we found that in 2009 we had about 68,000 physicians in the country. And that was a 4% increase over the previous year, the biggest increase we've seen since the last since the late 80s. And so this is suggesting that we are getting more physicians coming into the system. But the report we released today just helps us to understand a little better what it looks like as physicians are leaving the system, to help to inform those numbers a little better.
How do you think administrators should use the information in the study as they plan going forward?
I think this information just adds a piece to the puzzle. It also helps them to understand how physicians are reducing their activities as they get older. We focused, for example, on family physicians, and we found that there wasn't much difference among any age group in terms of the procedures that physicians provide, for example, assessments or mental health care, regardless of their age. But we did find that as family physicians, reached their older years, they began to reduce their practices and began to do less, for example, inpatient care or care that required more advanced procedural skills, such as in obstetrics and the field of anesthesiology, for example. So this helps, this kind of information helps physician workforce planners to better understand how to replenish the supply of physicians as physicians ease out of the profession.
Well, thank you for taking the time to talk to us today.
Thank you very much. It was a pleasure.